Thank you very much. We have a time maybe for one, eventually two questions. If we are very fast, we go to our friend John Zagacostas. John.
Good afternoon. I was wondering, can you hear me, sir?
Yes, please.
Yes. Good afternoon. Coming to the comments of Dr. Tedros earlier on introducing strict disciplines on wet markets when they're reopened, we've been through this debate before with SARS, with Avian, calling for good animal husbandry, and there have been some exemplary examples to my knowledge, and Vietnam has been one of them. And how much is Vietnam's very good performance in this pandemic due to that very, very good animal husbandry?
Hi, John. We miss you at the press conferences. I think, well, obviously, Vietnam deserve praise for anything they do to manage the animal-human interface, but in this particular case, their performance in containing the disease has been in relation to imported cases in humans. So in that sense, I wouldn't believe that necessarily, it's probably protecting Vietnam from other diseases, but at this point it's been the public health action and the action of the government with an all-of-government approach that has led to a pretty good performance in controlling the spread of the disease. With regard to the broader issues in terms of markets and other things, we have work to do. A lot of work has to be done at the national level. A lot of work has to be done at the international level. It needs a One Health approach. We have a tripartite arrangement with our colleagues at OIE and FAO. But this is what many have been speaking about for many years. We live on one planet, and we need a One Health approach. Threats to human health in the main come from the animal kingdom, or epidemic threats, emerging diseases and zoonosis. So managing the interface between animals and humans is extremely important, and that interface has been stressed by climate variability, by environmental exploitation, by the illegal trade in wildlife, and many, many other factors. And like those other things like climate change, it's not that possible to deal with simplistic. There's no simple way to deal with that. It requires a complex, again, all-of-government response. It requires an approach to regulation that doesn't drive things underground. It's really important at this point that we ensure that right now around the world there's a lot of illegal trade in wildlife. We need to be very, very sure that markets are safe, they're well regulated, they're well run, but as the Director General has said, many, many millions of people get their primary source of nutrition from such markets. How do we make markets safe? How do we make markets do their job, which is provide nutritious food for people in a manner which is safe? And that's going to require a very deep discussion between countries, within countries, and across sectors in order for that to happen.
I would like to add to that. My background is in emerging diseases and zoonotic pathogens. These are viruses that jump from animals to humans. And I was very fortunate to spend almost 2 years in Cambodia, almost 15 years ago now, where I was working at Institut Pasteur, and I was studying avian influenza, H5N1. And what we were doing is we were working in the markets, and there are hundreds of researchers, maybe more than that, in the area of Southeast Asia that have looked at markets and have looked at animals in the markets, and where do those animals come from? Where are they onward sold? How are they sold? How are they sold in a safe manner to keep the people who are working with those animals, to keep the people who are buying those animals safe? What we have learned from the sale of animals in markets is that there are safe ways to do this, and that you're right. What we learned from Vietnam, what we've learned from Cambodia, what we've learned from Thailand, what we've learned from China in terms of the safe operation of these markets needs to be carried forward. It needs to be done better, and it needs to be done better at a global level. And we work very closely with FAO and with OIE, and we have guidance on how these markets can be operated safely to ensure that we prevent and we minimize the opportunity for these viruses to jump from animals to humans. So there is a long way to go there, but we have learned a lot over the years with avian influenza, with SARS, and we still need to learn about COVID-19 and the zoonotic origins of COVID-19.